If someone has no feeling in their feet, or they have peripheral neuropathy, or if someone continually has cold feet. Perfect health requires perfect circulation, and perfect circulation means your feet and your hands are warm. So what you do if someone has cold feet, you cannot do this treatment to them. Because if they have continually cold feet and you put the cold feet in hot water, you can damage the tissues.
More than 70% of common ailments can be effectively treated at home without relying on pharmaceuticals. In an age where we often reach for a pill at the first sign of discomfort, Dr. Barbara O'Neill challenges conventional wisdom by unveiling 5 astonishing home remedies that promise to heal faster than traditional medicine. With decades of experience in holistic health, Dr. O'Neill reveals how simple natural ingredients can not only cure symptoms, but also promote overall wellness, often in a fraction of the time it takes for over-the-counter solutions to kick in. These remedies are backed by scientific research and numerous testimonials from those who have experienced their transformative power. Join us as, in this video, we explore these groundbreaking alternatives that could revolutionize your approach to health and well-being, empowering you to take control of your healing journey, naturally and effectively. Don't miss out on the chance to reclaim your health today. Dr. Barbara O'Neill explains that activated charcoal, when used as a poultice, is a powerful detoxifying agent capable of treating a wide variety of conditions by drawing out toxins from the body. Activated charcoal's ability to absorb harmful substances stems from its extremely porous structure, which significantly increases its surface area, allowing it to trap impurities like bacteria, viruses, and toxins. This makes it particularly effective in dealing with wounds, infections, and even venomous bites or stings. By applying the charcoal poultice to an affected area, the charcoal binds to toxins and pulls them to the surface, promoting faster healing by removing these harmful substances from the body. Dr. O'Neill notes that activated charcoal can also be highly effective for addressing deeper infections or toxins that have entered the bloodstream or tissues. The charcoal's unique absorbent properties allow it to extract more than just surface-level contaminants. It can also draw out deeper-seated toxins, including heavy metals, chemicals, and drug residues. This versatility makes it useful for treating a range of skin conditions, including insect bites, abscesses, boils, and other bacterial infections that require detoxification for effective healing. Additionally, its anti-inflammatory properties help reduce swelling, which is especially important for conditions like cellulitis, where inflammation can significantly worsen the infection and prolong recovery time. By reducing inflammation, the poultice not only aids in pain relief, but also accelerates the overall healing process. In more severe situations, such as snake bites, Dr. O'Neill highlights the critical role that a charcoal poultice can play.
I'm going to give you the recipe for the flu bomb. So the flu bomb can be used for bronchitis, it can be used for asthma, it can be used for the flu, it can be used for pleurisy, it can be used for pneumonia, it can be used for sinus or a head cold. The first ingredient is garlic, and the garlic is crushed. I'm not putting an amount on there because some people can handle that much garlic, some people can only handle half that garlic, so it depends what you can handle. Next ingredient is ginger. And the ginger is usually, well, it can be finely grated, and usually the ginger is about 1/4 teaspoon. The next ingredient is eucalyptus oil.
While not a substitute for professional medical treatment, a charcoal poultice can act as an immediate measure to slow down the spread of venom in the body. The activated charcoal binds to the venom, reducing its mobility and potentially minimizing the severity of the bite while waiting for further medical intervention. This same principle applies to other venomous bites or stings, including those from insects or spiders, where the charcoal can reduce both pain and swelling while neutralizing toxins. Furthermore, the charcoal poultice is generally well tolerated, even for individuals with sensitive skin, as activated charcoal is inert and non-toxic. It introduces no irritants into the wound, unlike some conventional antiseptics or chemical treatments, which may aggravate sensitive or damaged skin. Dr. O'Neill emphasizes that the ease of making a charcoal poultice adds to its appeal as a home remedy, A basic poultice can be made by combining activated charcoal powder with water to create a paste, which is then spread onto a piece of cloth and applied directly to the skin. This makes it highly accessible and practical in situations where immediate medical care is not available. Dr. Barbara O'Neill emphasizes that hot and cold therapy is an effective, non-invasive method for addressing injuries, especially sprains and strains. The principle behind this therapy lies in the way it manipulates blood flow. Heat causes vasodilation, expanding blood vessels and allowing increased blood flow to the affected area. This helps deliver oxygen and essential nutrients to the tissues, aiding in repair and reducing muscle stiffness. Cold application, on the other hand, induces vasoconstriction, narrowing blood vessels, which reduces blood flow, limits swelling, and numbs pain by lowering the metabolic rate of tissues. This alternating of hot and cold is what enhances the therapy's effectiveness. Dr. O'Neill advises that the technique be applied in cycles. Typically, heat for 3 minutes followed by cold for 1 minute. The key to the therapy's success is in the repetition of these cycles. By continuously alternating, the body is triggered to pump blood more vigorously, creating a flushing effect. This mechanism not only decreases inflammation, but also accelerates the removal of waste products from the affected area. The increased blood circulation brought about by the heat also supplies the tissues with a steady stream of immune cells and repair factors, while the cold helps manage the inflammatory response, preventing further damage from excessive swelling. Dr. O'Neill highlights that the therapy is particularly useful during the recovery phase of injuries. Cold applications can be more beneficial immediately after an injury occurs, as they help to control initial inflammation. Heat becomes more effective as the injury begins to heal, and the tissues require more blood flow for regeneration. For people suffering from conditions like arthritis or chronic joint pain, this therapy can also offer symptomatic relief as it reduces stiffness while controlling pain. However, Dr. O'Neill warns against the prolonged use of heat in the early stages of an injury, as this may exacerbate swelling. Timing is critical in applying this therapy. She notes that alternating hot and cold for about 15-20 minutes can produce optimal results, but longer sessions are not advised. Dr. Barbara O'Neill highlights the significant benefits of castor oil packs in addressing various health conditions, including liver issues, ovarian cysts, and lymphatic congestion. According to her, castor oil contains ricinoleic acid, which has anti-inflammatory and analgesic properties.
Which is a olive oil and cayenne pepper compress. Now what I've got is I've got cling wrap down there, and I've got a double layer of kitchen paper, and I'm going to sprinkle it with a little bit of olive oil. You could use castor oil if you like, but olive oil will suffice, and you spread it over the area, because what you want to do is put enough olive oil on there so that the cayenne pepper will stick to it.
When applied to the skin, the oil penetrates deep into tissues, promoting healing at a cellular level. Dr. O'Neill suggests that the therapeutic effect of castor oil comes from its ability to increase circulation and stimulate the lymphatic system, helping the body eliminate toxins more efficiently. This makes it particularly effective for individuals dealing with liver dysfunction, as the liver plays a central role in detoxification processes. Dr. O'Neill explains that castor oil packs work by enhancing circulation in specific regions of the body where they are applied. This increased blood flow accelerates tissue repair and reduces inflammation, which can be beneficial for those suffering from ovarian cysts or other reproductive system issues. She advises applying castor oil packs directly over the abdomen or the affected area, as this allows the oil to penetrate through the skin, improving tissue function and reducing pain. In addition to these benefits, Dr. O'Neill emphasizes that castor oil packs can also help in reducing fluid retention by enhancing lymphatic drainage. The lymphatic system, which is responsible for removing waste products from the body, can become congested due to poor circulation or toxin overload. Applying castor oil packs can stimulate this system, clearing blockages and encouraging the removal of excess fluids and toxins. This effect is particularly helpful for conditions such as edema or inflammatory joint problems, where fluid buildup contributes to discomfort. Dr. O'Neill also mentions that regular use of castor oil packs can help dissolve scar tissue and adhesions. The deep penetration of castor oil helps to soften and break down fibrous tissue, which can be useful in cases of old injuries, post-surgical adhesions, or conditions like endometriosis. Moreover, she believes castor oil packs can enhance the function of the digestive system by promoting better peristalsis and reducing bloating or constipation. The external application of castor oil near the intestinal region can stimulate bowel movements and improve digestive health. Dr. Barbara O'Neill advocates for the use of ginger compresses as a therapeutic remedy for a variety of health issues, particularly respiratory conditions and joint pain. The compress, made by infusing fresh ginger in hot water and soaking a cloth in the solution, harnesses ginger's potent anti-inflammatory properties to target inflammation and pain. These properties are attributed to gingerol, the active compound in ginger, which has been shown to inhibit pro-inflammatory cytokines, thereby reducing swelling and discomfort in affected areas. In respiratory ailments such as bronchitis or asthma, ginger compresses can provide relief by helping to clear mucus, soothe the throat, and improve circulation to the lungs, enhancing oxygen delivery. The heat from the compress not only amplifies ginger's therapeutic effects, but also aids in relaxing bronchial tissues, leading to improved airflow. Additionally, the warmth of the compress can stimulate blood flow to the respiratory region, facilitating quicker recovery and reducing the severity of symptoms. For joint pain, particularly associated with arthritis or injury, the analgesic properties of ginger can effectively alleviate discomfort. By applying a ginger compress to the affected joint, the anti-inflammatory effects penetrate the skin, targeting inflammation at the source.
If you apply a ginger poultice anywhere where there's inflammation, the ginger pulls the inflammation out of the joint to the skin, and the skin gets really hot. So if you apply this to the lower back, the heat relaxes the muscles, and yet the ginger is reducing the inflammation. So you do about that much, and then how you make the poultice is you put the left side over and the right side over, and the bottom comes up and the top goes down. So you can see I've made like a little package there. And then I turn that over, and the part that's touching the skin is where you've just got one layer.
This application promotes a reduction in pain and stiffness, encouraging greater mobility. Studies have shown that ginger can also modulate the body's pain perception pathways, providing a natural alternative to over-the-counter analgesics. Moreover, ginger compresses can be beneficial for muscle soreness after physical exertion. The combination of ginger's anti-inflammatory action and the compress's heat helps to relax tense muscles, reducing soreness and enhancing recovery post-exercise. This makes it a valuable tool for athletes or those engaging in regular physical activity. The use of ginger compresses is also supported by the holistic approach to wellness, as they can be easily incorporated into daily routines without the need for pharmaceuticals. The compresses can be used alongside other treatments, offering a complementary strategy for managing chronic conditions. Dr. O'Neill emphasizes that the accessibility and simplicity of ginger compresses make them an appealing choice for individuals seeking natural remedies, which clearly shows ginger's role not only as a culinary spice, but also as a powerful ally in promoting health and healing. Cayenne pepper, rich in capsaicin, has garnered attention for its potential therapeutic effects on neuropathy, according to Dr. Barbara O'Neill. Capsaicin is the active compound in cayenne that provides its distinctive heat and is believed to contribute to its medicinal properties.
So let's have a look at internally. Internally, it'll heal a stomach ulcer, because what the cayenne does, it causes a constriction of any open blood vessels.
O'Neill emphasizes that topical application of capsaicin cream can result in significant pain relief for individuals suffering from neuropathy, a condition characterized by nerve damage that often manifests as pain, tingling, or numbness, typically in the hands and feet. The mechanism by which capsaicin alleviates neuropathic pain involves the depletion of substance P, a neuropeptide associated with transmitting pain signals. By applying cayenne pepper topically, individuals can effectively reduce the concentration of substance P in the affected areas, leading to diminished pain perception. In addition to topical applications, Dr. O'Neill suggests that consuming cayenne pepper can also play a role in nerve health. When ingested, capsaicin may enhance blood circulation, which is crucial for delivering oxygen and nutrients to nerve tissues, thereby supporting their regeneration and repair. Improved circulation can facilitate the healing of damaged nerves, potentially accelerating the recovery process associated with neuropathy. Furthermore, Cayenne's anti-inflammatory properties may contribute to reducing inflammation in the nervous system, a common factor exacerbating neuropathic pain. By modulating inflammatory responses, cayenne pepper can create a more conducive environment for nerve healing. Dr. O'Neill highlights that cayenne pepper also possesses antioxidant properties, which can protect nerve cells from oxidative stress, a damaging process often implicated in the progression of neuropathy. This protective effect may help preserve nerve integrity and function, offering additional support to individuals dealing with nerve damage. Additionally, cayenne pepper's ability to stimulate endorphin release can lead to natural pain relief, creating a dual effect: direct pain alleviation through substance P depletion, and indirect relief through enhanced mood and decreased perception of pain. Moreover, the versatility of cayenne pepper allows for various consumption methods, including capsules, powders, or as an ingredient in food, making it accessible for those seeking alternative treatments. Dr. O'Neill's insights into the potential benefits of cayenne pepper in managing neuropathy challenge conventional approaches and open up new avenues for individuals looking for natural pain relief and nerve regeneration strategies. So, which remedy surprised you the most? Have you tried any of these at home? Let us know in the comments. And speaking of effective home remedies, don't think these are all. This is a vast, unexplored field often suppressed under the shadow of conventional medication. For example, most of you use conventional antibiotics for any illness, as per a doctor's recommendation. They come with side effects even doctors don't deny. But did you know that there are natural antibiotics which act faster and more effectively on your body without causing any side effects? Just click on this video and watch what they are, how they work, and what Dr. O'Neill says about them. If you found this video helpful, don't forget to like, subscribe, and hit the bell icon for more health tips and remedies. Stay healthy.